Catherine Walsh sat in the waiting room, her hands clasped tightly in her lap. At 26, she'd avoided this appointment for far too long. The soft blue walls were meant to be calming, but her heart raced nonetheless. She'd always been reserved, the quiet one in her family. Growing up in a small Midwest town, she'd been taught that some things simply weren't discussed. Even now, living in the city, working as a librarian, she carried that shyness like a familiar coat. The nurse called her name. "Catherine, Dr. Harrison will see you now." Catherine followed her down a corridor, her nervousness building. She'd specifically requested a female doctor, but there had been a last-minute scheduling change. The receptionist had assured her Dr. Harrison was excellent, professional, and highly recommended. The examination room was standard, the same soft blue as the waiting area, with medical equipment neatly arranged. Catherine changed into the gown, her hands trembling slightly as she tied it. A knock at the door. "Miss Walsh?" "May I come in?" The voice was male, gentle, professional. "Yes," Catherine managed, her voice barely above a whisper. The door opened, and Catherine's breath caught. Dr. Harrison was young, perhaps in his early 30s, with dark hair styled neatly, wearing a white coat over a blue shirt and tie. A stethoscope hung around his neck. But what struck Catherine most were his eyes. Kind, intelligent, putting her immediately at ease despite her embarrassment. "Hello? Miss Walsh, I'm Dr. Andrew Harrison." He maintained a respectful distance, his manner completely professional. "I understand you were expecting Dr. Chen today. She had a family emergency. I apologize for the last-minute change. If you're uncomfortable, we can reschedule." Catherine shook her head quickly. "No, it's fine. I've already waited too long for this appointment." Andrew nodded, pulling up a stool and reviewing her chart on his tablet. "I see you're here for a routine examination. Is there anything specific that's been concerning you?" His tone was so matter-of-fact, so professional, that Catherine felt some of her anxiety ease. She explained her reasons for the visit. It had simply been years since her last checkup, and she knew she needed to be responsible about her health. "That's very wise," Andrew said warmly. "Prevention is always better than treatment. Now I want you to know that you're in control here. If at any point you feel uncomfortable, we can stop. Your comfort and consent are my top priorities." Something in his words, in his genuine respect, made Catherine relax further. This wasn't what she'd feared. This was simply health care, provided by someone who clearly cared about his patient's well-being. The examination proceeded professionally. Andrew explained everything before he did it, maintained appropriate conversation to keep her at ease, and treated her with the utmost respect. His manner was so gentle, so reassuring, that Catherine forgot to be embarrassed. When it was finished and Catherine had dressed, Andrew returned to discuss the results. "Everything looks perfectly healthy," he said with a smile. "You're doing all the right things. I'd recommend coming back for a checkup next year, but there's nothing to worry about." Relief flooded through Catherine. "Thank you, Dr. Harrison. I was really nervous." "That's completely natural," Andrew said kindly. "Many people feel anxious about these appointments. I'm glad I could help." As Catherine gathered her things, she noticed a framed photograph on his desk. Andrew at a ribbon-cutting ceremony, surrounded by hospital staff. "That's from when we opened the new Women's Health Wing," Andrew explained, noticing her gaze. "It's been a passion project of mine for the past 3 years." "You built a hospital wing?" Catherine asked, surprised. Andrew looked slightly embarrassed. "I was fortunate to have resources to invest in health care. My parents were wealthy, and when they passed, they left me their estate. I decided to use it to improve medical care, especially for women who might not otherwise have access to quality treatment." Catherine realized then that this wasn't just a doctor. This was someone who dedicated his wealth to helping others. "That's remarkable," she said softly. "It's just the right thing to do," Andrew replied simply. "Health care shouldn't be a luxury." Something in his humility, in his genuine commitment to helping others, touched Catherine deeply. This man could have done anything with his wealth, lived any lifestyle he chose. Instead, he was here, treating patients with kindness and respect. As Catherine left, Andrew did something unexpected. "Miss Walsh, this might be unusual, but I noticed you mentioned you work at the library. I'm actually looking for historical medical texts for our research department. Would you have time to help with that? I'd be happy to compensate you for your expertise." Catherine hesitated, then nodded. "I'd be glad to help." Over the following months, Catherine assisted Andrew with his research. She discovered he was establishing a free clinic for underserved women, funding it entirely himself. He treated wealthy patients and homeless patients with the same care and respect. Their professional relationship slowly became friendship. Andrew was brilliant but humble, wealthy but generous, successful but kind. Catherine found herself opening up to him in ways she never had with anyone. One evening, as they reviewed documents in the hospital library, Andrew said quietly, "Catherine, I hope this isn't inappropriate, but I've come to value our time together as more than just professional collaboration." Catherine's heart raced. "I have too." "I know we met in unusual circumstances," Andrew continued, "and I want to be respectful of that. But I'd like to take you to dinner if you'd be comfortable with that. Not as doctor and patient, but as two people who've become friends and might become something more." Catherine thought about the shy girl who'd walked into that appointment months ago. Terrified and embarrassed, she thought about the man who'd treated her with such respect that day, and every day since. "I'd like that very much," she said. Their relationship grew naturally, built on mutual respect and genuine connection. Andrew never made Catherine feel anything but valued and cherished. He appreciated her quiet strength, her intelligence, her kindness. A year later, Andrew proposed in the hospital library where they'd spent so many evenings together. "You taught me," he said, "that the most valuable things in life are often found in quiet moments, in genuine connection, in being seen for who we truly are." Catherine, no longer quite so shy, smiled and said yes. They married in a simple ceremony, donating what would have been spent on an elaborate wedding to the free clinic. Catherine became the clinic's director of patient advocacy, using her gentle manner to help other women feel comfortable and respected. Years later, Catherine would tell young women who came to the clinic, nervous and afraid, "I understand. I was scared too. But good health care provided by good people is nothing to fear. You deserve to be treated with respect and kindness, always." And she meant it, because one shy girl's awkward appointment had taught her that true wealth isn't measured in money, but in compassion, respect, and the courage to see people for who they truly are. Sometimes the moments we fear most become the doorways to the lives we were meant to live.